embryo with a cardiac activity. Everybody's eyes are directly going on to the cardiac activity, whether I am dealing with a live embryo or a abnormal embryo. You don't have to see only fetal heart. You have to see many things before, like the double decidual sign, whether I am dealing with an intra or an extrauterine pregnancy, I mean the pseudo-gestational or a true intrauterine pregnancy. Then I have to see for the DDS, that is, and the unobliterated uterine cavity. Then I have to see for a knee detachment, which we have discussed now. Then we have to see for the yolk sac, whether this is a normal yolk sac or an abnormal yolk sac. Then we have to see for the cardiac activity. The point is not only the cardiac activity to start with. You are having multiple things which you have to see in the fetal heart rate. The important point, what we have to see, not only you have to see for the fetal cardiac activity, whether it is present or absent, but you have to trace it. What I mean by trace, you have to see how many beats per minute. I am not very much worried about the fetal tachycardia, but I am more worried with a fetal bradycardia. Now let us see what fetal bradycardia means. Fetal heart rate, please note this, fetal heart rate of less than 80 beats per minute in an embryo with CRL of less than 5 millimeters is having a high embryonic demise. It means that if CRL is less than 5 millimeters and I am dealing with a 80 beats per minute, it is having a how much? 60% risk of demise. So in between 80 and 90 beats per minute, it is having 60% of risk of demise. Now see the importance. If everything is apparently normal, but fetal cardiac activity is also looking pulsating fetal heart, but the point is it is not pulsating more than 90, it is say 82, 83. More than half you will be losing, because 60% is the risk over there. Now, if it is in the bracket of 90 to 99, even the risk is there, 32% of risk is over there. Now, even if it is 100, still there is a 11% of risk. Now, what is normal is that I should have more than 100 beats per minute when I am dealing with a CRL of 5 millimeters. Please note these points. Now, as embryo is increasing in size, I mean, when the CRL is now in the bracket of 5 to 7 millimeters, the heart rate of 100 is associated with an abnormal, because here I should have more than 120 beats per minute. More than 120 beats per minute. So with an increasing CRL, the fetal heart should also increase. So the point here is that not only to label whether I am having a fetal heart activity pulsating plus or minus, no, you have to correlate. You have to correlate the fetal cardiac activity with CRL to label whether I am dealing with a fetal bradycardia or not. So, missed abortion. Now, what is a missed abortion? Everybody is very clear with this. Whenever there is no fetal cardiac activity. But more important is that sometimes we are getting confused whether there is a muffled fetal heart. For example, there is a muffled fetal heart. You are not getting very confident. You are not confident at that time whether these are transmitted pulsations or the fetal cardiac activity itself. Then simply put your fingers onto the maternal pulse, and if it is 72 beats per minute, and if that muffled fetal cardiac activity in inverted commas is also corresponding with the maternal pulse, then these are the transmitted pulsations, not the fetal cardiac activity. Point number one. Point number second, now see in this case, I am searching, for example, I am scanning this, I am searching for the fetal heart, I am not getting, I am not getting, I am not getting, I am now confused whether to label this as missed abortion or not. Why not to go to the yolk sac? I'm your doctor scanning, how are you, yolk sac? Yolk sac will tell you, I am very abnormal. Now, why this yolk sac is abnormal? See, I'm zooming on this. Why this yolk sac is abnormal? Because there is lot of calcifications. So the wall is calcified. So am I proving that yolk sac is helping you out? But you should know how the yolk sac will help you. So yolk sac is telling that the, the embryo, the fetus right now is a dead fetus. And mind my words, and if this fetal is alive, if this fetus is having 120 beats per minute, but in a setting of this yolk sac, I am having very, very bad prognosis. I will rescan that patient. If in this fetus, fetal cardiac activity is present, for example, if it is present today, there are high chances that it will not be present tomorrow or a day after tomorrow. Because yolk sac is telling me that I am calcified, my walls are calcified, so I am an abnormal yolk sac. Please consider me in your diagnosis. So anyhow, missed abortion is whenever you are not having any fetal cardiac pulsations. And please, at that time, when there is no fetal cardiac pulsations, see to for any detachment, see to for an abnormal yolk sac. And if you got any detachment or abnormal yolk sac, then you are on right track. That is the point. Now, blighted ovum and embryonic pregnancy means that there is no fetal pole, and embryonic, there is no embryo. And if there is no embryo, then that is a blighted ovum. So these are some pictures of blighted ovum. In this blighted ovum, usually I will be having a less of decidual reactions. A less of decidual reactions. A normal decidual reaction is more than 2 millimeters. Now, in that blighted ovum, I may have wrinkled walls over there, wrinkled walls, see over here, wrinkled walls over here. So that is blighted ovum. Now the decision making in early pregnancy. We will be showing you patients also today. We'll be showing you patients. First, embryo, if visualize it, and if visualize it, what is the what is cardiac activity? Status of cardiac activity, I mean. If cardiac activity is present, then next point is that what is the status of yolk sac? Now see, what is the status of yolk sac? Is yolk sac present and normal? Not only present, yolk sac present and should be normal. Then only everything is normal. And cardiac activity present means that cardiac activity present and normal. Please read as normal also. Normal word is absent over here, but read it with cardiac activity present and normal, yolk sac present and normal. Then only that is an abnormal pregnancy. Fetal heart rate, normal, routine, OBS. Now, if fetal cardiac activity is present and normal, now see, cardiac activity present and normal, then you have to see for the yolk sac. If yolk sac is absent or abnormal, what you have to do? Close follow-up. Yolk sac absent, that is very much abnormal. Now, next is the fetal heart rate. Fetal heart rate, if abnormal, now you know what is abnormal. Abnormal is that if it is not correlating with CRL, which we have just now discussed, then you have to again take a close follow-up. The point here is that not only you have to visualize the gestational sac, not only you have to get happy that there is a fetal pole with a pulsating fetal heart, you have to see many more things besides these only two things which you are more concentrating on. Now, cardiac activity if absent. Now, what if cardiac activity is absent? The CRL should be less than 5 millimeters, and if it is more than 5 millimeters, then that is missed abortion. But if it is less than 5 millimeters, I'm giving you the benefit of doubt. Maybe that you have missed it, or your machine is not resolving the things very clearly, or your scan plane is not cutting properly, and your machine is not adjusted. There are a lot of things you have to do with the machine. That is in our physics and machine settings course. Then you have to see whether the scan plane is cutting through that. Okay, I am giving you the benefit of doubt. If it is less than 5 millimeters, you can rescan. But if it is more than 5 millimeters, that is a missed abortion. Now, if CRL is less than 5 millimeters, you can take a follow-up scan after 1 week. And if it appears, maybe that you have previously missed that, or maybe that you are dealing with a late conception. That is why the fetal cardiac activity was not seen previously. So the point is that you have to scan each and everything what is discussed. You have to first see where is the yolk sac and what is the status of yolk sac. But before yolk sac, you have to not always jump onto the gestational sac. You have to think that maybe that I am dealing with the pseudogestational sac. These pseudogestational sacs in ectopic pregnancies, are seen in about 20 to 40% of ectopic pregnancies. So by the help of the double decidual sign, by the help of that unobliterated uterine cavity, you can make out that I am dealing with a North Pole or South Pole, the pseudogestational sac or a true intrauterine gestational sac. Then if the yolk sac is over there, then it is confirming that that is not a pseudogestational sac. Now, coming to these hematomas, the hemorrhage, you have to see it with respect to the placental site. If it is at the level of the placental site, there are high chances or that you will be losing that pregnancy. But if it is away from the placental site, the chorionic frontosome, the prognosis is good. Now, the yolk sac you have to see. We have discussed in detail that yolk sac. Then lastly, you have to see whether the cardiac activity, not only present, is correlating with the CRL or not. Then only the early pregnancy scan is complete. So this was all about the early pregnancy scan.